There's no doubt that heart disease is one of the biggest health issues we all have to contend with. We're going to talk a little bit more about it now with Dr. Donald Nardone. He is an interventional cardiologist from the Susquehanna Health Heart and Vascular Institute here at Williamsport Regional Medical Center. Dr. Nardone, thanks for being with us.
Thank you.
So we're going to begin by asking, the risk factors. You could be walking down the street, from what I understand, and potentially, have a lot of risk for heart disease. What are some things people should be considering?
Well, there are traditional risk factors that we know about, things like high blood pressure, high cholesterol, diabetes, smoking, family history of heart disease, obesity or being overweight, being inactive and not exercising enough. But any kind of chronic inflammatory condition can lead to a higher risk of heart disease. Your medical doctor, your primary care physician, actually has tools available to them that they can input your history and calculate what your estimated risk of having heart problems is over the next 5 or 10 years. And that's very helpful because that helps them to tailor a treatment plan to give you the greatest chance to reduce that risk.
Now, explain a little bit more the family history connection. I think we all have heard that family history plays a role in heart disease. How is that?
Family history is, again, one of these major risk factors, and your heredity, unfortunately, is the one thing you have no control over. All the other risk factors we can modify to some extent, but people who have a family history, particularly at a young age, before age 60 or so for a male relative or before age 65 or so for a female relative, are going to be at higher risk of developing heart disease during their lifetime. Again, you can't change that, but what you can do is try and treat the other risk factors more aggressively to kind of offset the effect of the family history.
Now, talk a little bit more about if you are experiencing heart problems or maybe getting into a heart attack, what does an interventional cardiologist do to help treat that type of patient?
Well, when people come to the hospital with chest pain and symptoms consistent with a heart attack, when that's confirmed by their electrocardiogram, we as interventional cardiologists try and get them to the cardiac cath lab as rapidly as possible to reopen the artery that's blocked and causing the heart attack. The sooner we can get the artery open, the less damage done to their heart and the better their prognosis is going to be for recovery.
All right, no doubt, very, very important information from Dr. Donald Nardone, an interventional cardiologist here at Susquehanna Health's Heart and Vascular Institute at the Williamsport Regional Medical Center. Doctor, thank you so much.
Thank you. And
don't forget, if you would like to make an appointment with one of the doctors here at Susquehanna Health, you can give them a call at 570-321-2800 or visit on the web, susquehannahealth.org.